Bipolar disorder versus depression. How are they different? Bipolar disorder and depression are both mental health conditions that can have a significant impact on a person's life. While there are some similarities between the two conditions, there are also some important differences. It's important to understand both conditions to get the most accurate diagnosis and treatment. Depression is a mental health condition that's characterized by a persistent feeling of sadness and loss of interest. Depression can also cause a person to experience changes in their sleep, appetite, and energy levels. Bipolar disorder is a mental health condition that's characterized by periods of both high and low mood. These mood swings can be severe and can cause a person to experience changes in their sleep, energy levels, and behavior. In this video, we will explore the differences between bipolar disorder and depression. We will also provide some information on the symptoms and treatment options for both conditions. So, watch till the end. First, let's discuss what's bipolar disorder. Bipolar disorder, also known as manic depressive disorder, is a mental illness that causes extreme mood swings. The highs or manic episodes can last for days or even weeks. During these episodes, people with bipolar disorder may feel happy, energetic, and productive, but they may also act impulsively and recklessly. The lows or depressive episodes can just be as intense. During these episodes, people may feel sad, hopeless, and exhausted. They may also have trouble concentrating, eating, and sleeping. These mood swings can be so severe that they interfere with daily life. Bipolar disorder is a serious condition that requires treatment. Bipolar disorder is a lifelong condition that can be challenging to manage. If you or someone you know is experiencing symptoms of the bipolar disorder, it's important to seek professional help. With proper treatment, many people with bipolar disorder can lead happy and successful lives. Secondly, what is depression? Depression is more than just feeling sad. It's a serious mental illness that can have a profound impact on every aspect of your life. Depression can cause you to lose interest in things you once enjoyed, withdraw from your friends and family, and even lose the motivation to go to work or school. Depression can interfere with a person's ability to work, study, eat, sleep, and enjoy activities. It can also lead to straining relationships and feeling hopeless, helpless, and worthless. There are different types of depression, and it can be caused by a variety of factors, including genetics, brain chemistry, and life events. Depression is not something you can just snap out of. It's a real illness that requires treatment. But with the right help, most people with depression can get better. If you think you may be depressed, talk to your doctor or a mental health professional. Now, the question that comes to mind is, how are bipolar disorder and depression different? Bipolar disorder and depression are two mental health conditions that often get confused with one another. But while they may share some similarities, they are quite different. Depression is characterized by feelings of sadness, emptiness, or hopelessness that last for at least 2 weeks. Bipolar disorder, on the other hand, is characterized by periods of both depression and mania. Mania is a period of abnormally high energy, mood, and activity level. So, what's the difference between the two? Here's a quick rundown. Depression is characterized by feelings of sadness, emptiness, or hopelessness. These feelings become a problem when they last for more than a couple of weeks and begin to interfere with your ability to function in your daily life. This is known as depression. Loss of interest in hobbies or activities. It's normal to lose interest in activities or hobbies that you once enjoyed. But if this loss of interest is accompanied by other symptoms, it could be a sign of depression, fatigue, or low energy. If you're experiencing fatigue or low energy that's persistent and affecting your quality of life, difficulty concentrating. Depression can make it difficult to concentrate. When you're depressed, it can be hard to focus on anything other than your negative thoughts. This can make it difficult to complete even simple tasks. Changes in appetite. Some people with depression lose their appetite and eat less than usual, which can lead to weight loss. Others find that their appetite increases and they start to eat more, which can lead to weight gain. Insomnia or hypersomnia. It's not uncommon for people with depression to experience changes in their sleep patterns. Some may find that they have difficulty falling asleep or staying asleep, while others may find that they sleep more than usual. Bipolar disorder is characterized by extreme mood changes. These changes can be so severe that they can interfere with a person's ability to live a normal life. Energy changes. People with bipolar disorder can swing from feeling incredibly energetic and happy to feeling low and down. This can happen over days, weeks, or even months. Bipolar disorder is more likely to involve changes in activity levels. These changes can be extremely disruptive and can make it difficult for people with bipolar disorder to live normal, productive lives. Bipolar disorder is more likely to involve changes in sleep patterns. This can make it difficult to function during the day and can lead to fatigue and other problems. People with bipolar disorder often swing from feeling very happy and energetic, known as manic episode, to feeling very sad and depressed, known as a depressive episode. These mood swings can be so severe that they interfere with a person's ability to function in their everyday life. Now, we will discuss how a bipolar disorder and depression are diagnosed. Bipolar disorder and depression are two very different mental disorders, but they are often diagnosed in similar ways. Both disorders are diagnosed based on a combination of symptoms, medical history, and family history. There are several different types of bipolar disorder, so the diagnosis process can differ slightly depending on the type of the bipolar disorder a person has. But in general, the diagnosis of the bipolar disorder begins with a physical exam and a discussion of symptoms. A mental health professional will then ask about family history, medical history, and any other factors that could contribute to the development of the bipolar disorder. The diagnosis of depression is similar to the diagnosis of the bipolar disorder, but there are some key differences. First, depression is not divided into different types like bipolar disorder. This means that diagnosis process is often simpler. Second, people with depression are not typically diagnosed based on family history or other factors. Instead, the diagnosis is based on symptoms and how long they have been present. Next, the causes of bipolar disorder and depression. Bipolar disorder and depression are both mental disorders that can have a profound effect on a person's life. While there is no one cause of either disorder, there are several risk factors that have been identified. Bipolar disorder is thought to be caused by a combination of genetic and environmental factors. Family history is a strong risk factor, as bipolar disorder appears to run in families. However, not everyone with a family history or bipolar disorder will develop the disorder, and environmental factors are also thought to play a role. Stressful life events, such as the death of a loved one or a job loss, can trigger a manic or depressive episode in someone with bipolar disorder. Depression also appears to have a genetic component, but it's also thought to be caused by chemical imbalances in the brain. These imbalances may be the result of the combination of genetic and environmental factors. For example, someone who has a family history of depression may be more likely to experience it themselves, even if they have no other risk factors. Likewise, someone who experiences trauma or stress may be more likely to develop depression, even if they don't have a family history of the condition. Symptoms of bipolar disorder and depression. Bipolar disorder and depression are two separate mental disorders that can share some similarities in symptoms. However, there are some key distinctions between the two disorders that are important to be aware of. Both bipolar disorder and depression can cause feelings of sadness, hopelessness, and emptiness. However, in bipolar disorder, these low moods are alternated with periods of high energy, elation, and mania. Depression, on the other hand, is characterized by consistently low mood that does not fluctuate. Bipolar disorder can also cause erratic behavior, including impulsive spending, risky sexual behavior, and substance abuse. Depression, on the other hand, tends to lead to withdrawal and isolation. If you are experiencing any of these symptoms, it's important to talk to a mental health professional to get a proper diagnosis. Bipolar disorder and depression are both serious mental illnesses that can cause a great deal of suffering for those affected. They can also be difficult to distinguish from one another, which is why it's so important to get a professional opinion. If you are experiencing any of the symptoms listed above, please do not hesitate to reach out for help. At last, we will discuss the treatment of the bipolar disorder. Bipolar disorder is a mental illness that's characterized by extreme mood swings. These mood swings can range from periods of depression, where a person feels hopeless and down, to times of mania, where a person feels overly happy and full of energy. Bipolar disorder can be a very difficult illness to live with, but there are treatments available that can help. There are a few different types of treatment for the bipolar disorder, including medication, therapy, and lifestyle changes. Medication is often used to help stabilize mood swings and help control symptoms. Therapy can be used to help a person manage their illness and develop healthy coping mechanisms. Lifestyle changes, such as getting regular exercise and eating a balanced diet, can also help to improve symptoms. If you are someone you know is struggling with a bipolar disorder, there is help available. There are many resources out there that can provide support and assistance. Don't hesitate to reach out for help if you need it. Treatment of depression. Depression is a serious mental illness that can have a profound effect on a person's life. Fortunately, there are several effective treatments available for depression. There are many different types of depression, and most effective treatment will vary depending on the individual. Some of the most common treatments for depression include antidepressant medication, therapy, and self-care. Antidepressant medication can be effective for some people, but it can also have side effects that can make it difficult to take. Therapy can help people with depression to understand and work through their feelings. It can also provide tools and strategies for dealing with difficult situations. Medication can be used to help relieve the symptoms of depression. Some common types of medication used to treat depression include antidepressants, anti-anxiety medication, and mood stabilizers. Self-care is also an important part of treating depression. This can include things like exercise, relaxation techniques, and positive self-talk. If you're struggling with depression, it's important to seek professional help. Depression is a treatable condition, and with the right help, you can start to feel better. Although both mental illnesses can cause similar symptoms, they are different in many ways. Bipolar disorder is characterized by extreme mood swings, while depression is characterized by a persistently low mood. Treatment for bipolar disorder typically involves medication and psychotherapy, while treatment for depression may also include antidepressants. If you or someone you know is struggling with either bipolar disorder or depression, please reach out for help. If you enjoyed the video, be sure to like and subscribe our channel so you don't miss any future videos. And share your thoughts on this in the comment section below. Thanks for watching.